Okay, and just like Rodrigo mentioned, our program receives grants, and one of those grants is the Medi pilot project. The grant, we are sub-grantees under California Coverage and Health Initiatives, and we are collaborating with CHI Napa County and Carrington for this project. Our task is to outreach the potential Medi beneficiaries and then connect them to individuals to health and life agents, so they can review Medicare options and enrollment. Our team will provide Medicare enrollment assistance, case management, education, post-enrollment support services, and also help them with their renewals. So that's the reason we came up with, this training is being offered to learn a little bit more about Medicare, because we know that in order to help our community, we need to understand the project, the program, so that we can better help them. As part of your training material, there's some resources that we've included. Those resources are created here within our program. Partners collaborate to create all those materials. So if you need any materials, please feel free to reach out to me. We have copies. We can also place a printing order for you. And you'll also see that we included a client referral form. So if you have any clients that need our assistance with any of the programs that we work with, please feel free to refer them over to us, and you'll get a notification of the outcome of those referrals. We like to keep track of all those referrals and inform the referring agency so that they know what happened with their clients. So now that I've shared a little bit about the project, I'm going to turn it over to Rodrigo, who will be introducing our presenter for today.
And just before I introduce our presenter, I do want to remind everyone to use their full name for attendance purposes. Please keep your microphone muted. And of course, the session is being recorded. You can ask questions through the chat, just like we did last time. Questions will be made anonymously, will be asked in the group anonymously. We won't mention your name. You can take a break as you need. And if possible, please turn on your video for participant interaction. All right. And now, without further ado, our presenter today, as last week, was Peter Bauer. He's back on the Starship Enterprise deck. He's the Senior Medicare Patrol and lead for the National Training Program through the Centers for Medicare and Medicaid Services. And he has served for 23 years as the San Francisco lead for the MTP. Peter, welcome, and thank you for joining us again and being providing us this valuable information.
And thank you for having me. I got some good news. I don't know if you guys will get it, but we're going to get some rain up here on Saturday and Sunday. It's going to be just a drop in the bucket of what we need, but I don't know if the storm system goes down. It looks like it's going to be coming down and hitting you guys. So get ready. There may be some moisture headed down towards you guys.
We're hoping.
So today we're going to just blast. This is going to be the second drink out of the fire hydrant. The first drink was last week, and we're going to cover prescription drug coverage, and then also Medicare Medicare Advantage, and think about it, other ways to get your Medicare. So that's going to be what we're going to spend today on. So next slide, please. We'll start with drug. Prescription drug coverage is it's really easy to remember. It's D as in drug. You can add it to original Medicare, and it's usually already included in your Medicare Advantage plans. It's an optional benefit available to people with Medicare. It's a free country. You can sign up for it or not. But again, why wouldn't you want to have prescription drug coverage, since many of us have prescription drug costs later in life? They're run by private insurance companies that contract with Medicare. This is very important. You don't sign up for a Medicare Part D plan by calling Marisol, Rodrigo, or Peter. You go to the private company and sign up and get your Medicare Part D through the private company. They're provided through prescription drug plans. or through Medicare Advantage prescription drug plans. Some other Medicare plans may also offer prescription drug plans, and we'll discuss that during the Medicare Advantage prescription or the Medicare Advantage section. Next slide, please. How does Part D work? Part D is in drugs. First of all, it's optional. You can choose a plan. And if you decide, like many of my seniors that I know and love, they say to me, I'm not a pill popper, I don't take pills. You may have to pay a lifetime penalty if you join late. All the plans have formularies, and they will, but they got to cover a list of drugs. The list. So let me just start. The plans have formularies, and these formularies you can ask for and see the drugs that they cover. Those formularies must include a range of drugs for each category, and the drugs are subject to change, but you're going to be notified. The categories are very important to notice because we make all the prescription drug plans cover anti-seizure medications and anti-cholesterol medications. So each category will have some drugs in there. The challenge will be trying to find a plan that works best for you. Your out-of-pocket costs may be less if you use a preferred plan or preferred pharmacy. If you have limited income or resources, there's extra help for your Part D costs, and I'll be talking about that near the end. My friends at Social Security, my friends at the county say, when in doubt, fill it out. Ask for extra help if you're having problems with your Part D costs. Next slide, please. So the plans the costs vary by plan. Most folks are going to be paying a monthly premium to the plan and a yearly deductible if it's applicable. There's going to be co-payments or co-insurance, and the percentage of the cost while in the coverage gap begins at $4,020 for out-of-pocket spending in 2020. Sorry, I should have done the 2021. 4,130 in 2021, and there's going to be very little out-of-pocket spending after reaching the 6,550 in 2021. This is what is called catastrophic coverage. So you've maxed out, you've paid out of pocket, and you will have very little out of pocket costs for any further drug use. Next slide, please. So I'm just going to flash this slide up just to make sure you know what it is that your loved ones or your beneficiaries are talking about. Just like I had a IRMA income-related monthly adjustment amount for Medicare Part B, there's also one for Part D. Most people don't realize that. They just think, oh, it's only for Part B. So the people who make more in retirement pay more. And it was an act of Congress, and so that's what's happening. Is the people who make a lot in retirement, they unfortunately will get less of a subsidy from the federal government and will have to pay more premium for their Medicare Part D. Next slide, please. And this is just more of an awareness to realize that that you may have some folks that are asking questions about this. Next slide, please. So the late enrollment penalty, you may have to pay it if you wait to enroll. The exceptions are important to know. If you have something called credible drug coverage, or you apply for and get extra help, you're going to pay the penalty for as long as you have coverage, which is 1% for each month you could have had Medicare Part D but didn't take it, or another way of saying it is 1% for each month without credible coverage. And you multiply the percentage by the beneficiary's base premium. So here's an example. So you multiply, let's say 1% of $33.06 in 2021. Let's say you could have enrolled in Medicare Part D but didn't, and you waited a month and were penalized a month because you could have had it but didn't, boom, you would get 1% for 1% penalty for the rest of your life. Most people wait a whole year. So doing the math, it would be 12%. Which is different than Medicare Part B. If you remember last week, it's 10% a year. You could have had Medicare but didn't. For Part D, it's 12% per year. And the amount changes every year. In that, if you don't sign up for 2 years, then you get 24%. And of course, the monthly percentage base premium change goes up every year. It never goes down. Next slide, please. Part D cost considerations. The plans have formularies. Make sure the plan that you pick covers the prescriptions that you need to stay healthy. And a lot of our loved ones and beneficiaries use a preferred pharmacy, like one they could walk to, or one that they always, it's part of, it's in the same place where they grocery shop. So a lot of folks will want to have a preferred, they go to, or the pharmacist speaks their language. So, be aware when you do these Part D plan comparisons, there's a couple of variables. The pharmacy you want to work with, the prescriptions you need, then you can choose a plan to join. You may you may have to pay the lifetime penalty if you joined late, and I just talked about that in the last slide. The costs vary by plan, and the other thing to remember is there's extra help for those who are yelling about their prescription drug costs. You can have extra help paying for your Part D drug costs if you have limited income and resources. Social Security will accept your applications. I suspect you guys are in the business of helping people with applications, and the county will help people with these extra help applications. And my buddies at Social Security say, when in doubt, fill it out. Let the system decide if you don't have enough income, and if you have too many income and resources. Don't just trust I'm not going to fill it out. It's not worthwhile. You'd be surprised. Next slide, please. You must have Part A and or Part B to join a prescription drug plan. So it's conceivable that you just have Part A, that you can also have a prescription drug plan. You must have Part A and Part B to join a Medicare Advantage prescription drug plan. You must have Medicare A and B or only Part B to join a Medicare cost plan, which has Part D coverage. And I'm not clear there are any of those in existence in the Central Valley anymore. So we can forget about that point. You must live in the planned service area, which means you got to live in California for a California plan to work. Because you're in Kern County, I'm also here in Marin County. I also have a prison nearby, so you're going to get a lot of cases. Hey, I'm in prison, or I'm incarcerated. Can I get a Part D plan? No, the Part D doesn't work. In fact, Medicare, you cannot receive Medicare benefits while incarcerated. The state is responsible for your health care. And you can't be unlawfully present in the United States. So that means our undocumented friends cannot get Medicare Part D to work because they're not lawfully present in the United States. So this is actually, it's kind of the same part of the law that deals with the folks who are incarcerated. And you can't live outside the United States and expect Part D to work. So our friends who have retired to Costa Rica, They're sitting there, they're having a good time. Don't expect to use your Part D plan because it's funny. I had a wise guy once say to me, I'm not even thinking of buying my medication in the United States. It's so much cheaper here in Costa Rica. What's your beef about it? I can't work Part D. I don't need Part D. I live in Costa Rica. Drugs are cheap here. But it just realize it doesn't work for many folks will live in multiple countries, and so Part D works here in this country. It won't work in other countries. You must join a Medicare Part D plan to get the drug coverage. Okay, next slide. When can I enroll in Medicare Part B? During your 7-month initial enrollment period that I talked about last week, which is 3 months before you turn 65, 3 months after your birth month, the month you turn 65, and of course the month you turn 65. That's your 7th month. During the yearly open enrollment period is another chance for you to enroll in your Part D plan, which is October 15th to December 7th of every year, and the coverage would begin that next January. If you get your Part B for the first time during the general enrollment period, you can join a Part D plan from April 1st to June 30th with coverage starting July 1st. So again, this was something I talked about last week, where a person decided to wait to sign up for Part B, and so they missed their initial enrollment period and then do the general enrollment period. You may be able to join at other times, like if you're in a Medicare Advantage plan that offers prescription drug coverage. You can switch during the Medicare Advantage open enrollment period from Medicare Advantage plan to another between January and March of each year. If you're new to Medicare and you enrolled in a Medicare Advantage plan during your initial enrollment period, you can make a change within the first 3 months that you have Medicare. And there's a special enrollment period if you qualify. And usually what that is when you move. Like, let's say you're tired of Kern County, you moved over to Vegas. Boom, you're out of California, you're out of the plan. That would be a special enrollment plan, and you would be able to pick another plan that worked for you in Vegas. 5-star SEP. So there's a 5-star. There are Medicare prescription drug plans that every year are rated, and the ones that have 5 stars, you can jump out of your underperforming plan and jump into the 5-star plan. Next slide, please. Choosing a Part D plan. Compare plans by computer or phone. You use our Medicare Plan Finder, and notice I'm flashing my iPhone. We recently, 2 years ago, changed the Medicare Plan Finder to be less clunky. It used to be just a laptop game. You and I, Peter, Rodrigo, Marisol will be running around with laptops, setting them up at senior centers and helping seniors find a plan that worked for them. Not so much anymore. Most of us, I'm slowly, surely becoming an iPhone guy, and as are seniors. And so we've made Plan Finder able to work on mobile devices like iPads, iPhones, Google phones. So you can go to the Plan Finder, or you can use your laptop and go to Medicare.gov, Plan Compare, and pick a plan that works best for you. You can call 1-800-MEDICARE for the folks who are not interested in dealing with computers or screens. And Congress has made the provision for 1-800-MEDICARE to work 7 days a week, 24 hours a day. You have the local HICAP office who we give a grant to help people with Part D. So let's say you have a complex Part D case, the person takes lots of drugs, needs to have immunosuppressives. You can rope in our buddies at HICAP and they can help. If you need help finding who HICAP is, or if you're working in another state, a lot of times you have people from other states calling, go to our SHIP technical assistance center.org, and they can get you the local SHIPs nationwide. You already know the Kern County people, but if let's say you're working with a person in Kansas, you can get their local person in Kansas. To join a Part D plan, you go to Medicare.gov, plan compare, or so you can do it over the phone, through the iPhone, through the laptop. Wow, my phone went invisible. There it is. You can call 1-800-Medicare. You can enroll in the plan's website or call the plan. You need to involve Peter and his gang. You can call straight to the plan. You can complete a paper enrollment form, and if you go to any pharmacy during this time in October, you'll see a whole bunch of enrollment forms, and you can complete one of those enrollment forms and send it in to the plan. The plan will notify whether it's accepted or denied your application, and just be rest assured there's a patient protection that you can't be denied based on health condition or the drugs that you take. Next slide, please. So what should you consider when enrolling in a Part D plan is if you have credible prescription drug coverage. Now, this is a very, a loaded term, credible coverage. What is credible coverage? It's that your former employer, or for example, the VA, will pay at least as much as the standard Medicare drug coverage. Will you or your spouse or dependents lose health coverage if you join a Medicare drug plan? How do your out-of-pocket costs compare to the out-of-pocket drug costs of the Medicare drug plan? And how will your costs change when you get extra help with your Medicare drug costs? So these are all things to consider. If you don't have a credible prescription drug coverage, later enrollment may mean you have to pay a penalty, or if you go 63 days without without credible coverage. I'm going to modify this slide a little bit by giving you a sneak preview. Remember how we talked about the veterans? All the guys that have veterans benefits have credible coverage through the Veterans Administration. Most of the CalPERS people who've worked with the state and the CalSTRS, the city, the school teachers in the school districts, most of them have credible coverage, and every year they get a notice from their retiree insurance that on the whole, we have determined that our drug coverage in your retirement plan is equal to or greater than Medicare. Just tell the folks to save that and just realize as you're counseling them that they have what's called credible coverage. Their drug coverage is better than Medicare's. Next slide, please. Okay. Medicare prescription drug coverage is also called, and everyone knows how to vote, right? I guess I can vote too, right? Yeah. Okay. So everyone remember to vote and hit submit. I just did it. So who's our scorekeeper? Who's going to report back on how the
I'll go ahead and show you the results. And once I share the results, Peter, I believe everybody's going to be able to see it. So we have 16 people that have voted out of 25 that are currently with us.
So this is how it works in the universities and in the pharmacy schools and med schools. So this is we're taking it up a notch.
Okay, we're gonna about to hit the 1 minute mark. I will be ending the poll in a few seconds. Okay, and I'll be sharing results.
Oh, bingo. And I guess, nobody fell for the trick as far as Part B. There are some drugs that are covered under Part B. I might be talking about that I talked about it very briefly last week. Like if Medicare Part A did the transplant, let's say you got a kidney transplant and Medicare paid for it, then Medicare's on the hook for paying for the immunosuppressives. So those immunosuppressives would actually be billed to Medicare Part B, but nobody fell for the trick on this one. Okay, next slide. Okay, check your knowledge, question 6. It's this July, you enrolled in Medicare last year, but didn't enroll in Medicare drug plan. Generally, when is your next chance to enroll in Part D?
Okay, we'll give you 1 minute to cast your vote.
It's kind of tricky.
We're hitting the 45-second mark, and 14 people out of 25 have voted. Okay, we have hit the 1 minute mark. I'm going to go ahead and close the poll and share results.
Man, you guys are great. You guys are ready for graduate school. So yes, so it's like I voted the same as everybody else. You have to wait till the open enrollment periods or next bite out of the apple to enroll in a Part D plan. I noticed a couple people put the next birthday. In California, you do have something called the birthday rule, but that only applies to Medigap or Medicare supplemental policy. So that's kind of a trick question that we put there for the Californios. No other state really has that right to change things during your birthday. And that only applies to Medigap. It doesn't apply to Medicare Part D or any other thing. So we talked a little bit about Medigap last week, but that's how the birthday got on there. Okay, next slide. Okay, now we're going to switch to Medicare Advantage, and next slide. And how I like to tell people or discuss Medicare Part C or Medicare Advantage plans, it's another way for the beneficiaries to receive Medicare. So a lot of the times the advocates will say, oh, you signed your benefits over to the Medicare Advantage plan or Kaiser or Blue Cross or Humana. That's the way advocates talk about it. I always say, hey, you receive your benefits through the health plan. So you're getting your Medicare A, you're getting your Medicare B, you're getting your Medicare C, and you're getting your Medicare D all through a plan. So with that come advantages and some disadvantages. So that's what we're going to talk about. So for Medicare Advantage, you need to have Medicare A, you got to have Medicare B, you got to pay for your premium. Most of the plans include Medicare D, and they sweeten up the benefit pot by putting some extra benefits in there that are not covered, that are not normally covered, like vision, dental, vision, dental, exercise, and gym plans. So, and Medicare Advantage plan is another way to get your Medicare coverage. It's called Part C or MA plans or Medicare Advantage or Medicare Managed Care. They are offered by Medicare approved private companies that must follow the rules set by Medicare. So remember last week I was going through a huge litany of things that are covered under preventive services by Medicare. Guess what? All these Medicare Advantage plans have to provide those Medicare services because Medicare covers it, they got to cover it. If you join a Medicare Advantage plan, you still have to have Medicare. You'll get your Medicare A, hospital insurance, and Medicare B, medical insurance coverage from the MA plan, not from an original Medicare. You'll need to use healthcare providers who participate in the plan's network. And then realize that some of the plans offer out-of-network coverage. So this is a big one. If you sign up for a Medicare Advantage plan, you gotta go to the hospital and the providers and the doctors that the plan tells you to. Next slide, please. In a Medicare Advantage plan, you are still in Medicare with all Medicare's rights and protections. You still get services covered that are in Medicare Part A and Part B that we discussed last week. And you have the right to choose a plan that includes prescription drug coverage. And in fact, I believe in Bakersfield, they all include prescription drug coverage. So I don't think you can find one that doesn't. You can be charged different out-of-pocket costs. You can't be charged more than original Medicare for certain services like chemotherapy, dialysis, and skilled nursing facility care. So you may choose plan with extra benefits like vision, dental, or fitness or wellness benefits. Again, you have to look upon in Medicare Plan Finder or call the plan to find out a little bit more about what these extra benefits are. You have a yearly limit on your out-of-pocket costs. There's something, they have a concept of total out-of-pocket cost. So you have a yearly limit on how much money you put out, and then you get to the catastrophic level where the plan covers everything. Next slide, please. Next slide, please. Okay, so when can you enroll in a Medicare Advantage plan? Again, during the initial enrollment period, which is 3 months before you turn 65, the month you turn 65, and then 3 months after you turn 65. If you miss that, you have the general enrollment period, which is coincides with the Medicare Part A and B general enrollment period. Then you can enroll in a Medicare plan from April 1st to June 30th with coverage starting July 1st, just at the same time when Medicare would turn on. Then there's a special enrollment period in certain circumstances, like if you moved out of the planned service area. I used the example of the person cutting loose from Bakersfield and going over to Vegas, but it's also true for the guys from Vegas who want to move over to Bakersfield. They moved out of the planned service area, so they're entitled to enroll into another Medicare Advantage plan. If you've lost Medi-Cal in this state, or Medicaid in another state, or you lost extra help, then that entitles you to a SEP to get into a plan that works best for you. If you move into or out of an institution like a nursing home, and this is not like skilled nursing facility, but this is a long-term care type of situation. So that would get you into a special enrollment period also. There's also the 5-star special enrollment period from December 8th to November 30th of every year, where you can switch out of the Medicare Advantage plan that has 5 stars. You can switch to a 5-star plan. And I haven't read, I forget the Bakersfield paper. What's the Bakersfield paper? The
Bakersfield Californian.
The Californian. But I suspect at this time of year, you open up the Bakersfield California, you'll see Kaiser has 5 stars. You can come to Kaiser. So the plans that are 5 stars are proud of that, and they actively recruit. So usually by opening up your local paper and seeing it, you'll see half-page ads, full-page ads to that effect. And even though a lot of seniors still read the paper and they have questions about that 5-star plan. Next slide, please. When can I enroll in a Medicare Advantage plan? So there's a yearly open enrollment period from October 15th to December 7th. And think about this as a readjustment period. You were in, let's say, Blue Cross, and now you want to switch. You want to try Kaiser, you can do that. or you see there's another plan that is offering to pay for your Medicare, your Medicare Part B premium every month. They're going to say they'll pay up to $100 every month. Maybe you want to try that plan. You're allowed to change one change every year. So you can make a change during the open enrollment period every year until December 7th. Then there's a Medicare Advantage open enrollment period where you can one time switch. And this is each year, January to March. And coverage begins the first of the month after you make the switch. But you got to be already enrolled in one Medicare Advantage plan. You're just merely switching to another. And it's during the first 3 months of the year. To switch to another MA plan, and it's got to be with drug coverage. You can also drop your Medicare Advantage plan and return to original Medicare, and you can also join a Medicare prescription drug plan. So let's say you didn't like Medicare Advantage anymore, you want to go back to Medicare, you can do that during that time. If you're new to Medicare and you enrolled in a Medicare Advantage plan during the initial enrollment period, you can make a change within the first 3 months that you have Medicare. This is in recognition that people may not have gotten all the facts before they got into Medicare Advantage plan and they want to get out. And I've got some fine print at the bottom of this slide, which is very important. Note, if you drop Medicare supplemental insurance, Medigap policy to join an MA plan, you might not be able to get it back. So this is a key right that a lot of people don't really realize, is that Medicare supplement insurance or Medigap insurance, if you drop it, go into Medicare Advantage, you may not be able to get the same sweet plan that you had before. Next slide, please. I'll try my cursor. I don't think it works though. Oh, there you go. I saw the cursor's right above it now. So.
Oh, click.
Yeah, there we go. Okay. Should I join a Medicare Advantage plan? This is the decision point. You got to have A and B to join. Most plans offer very comprehensive coverage that include Medicare Part D coverage. It's kind of like the Round Table Pizza Wombo combo. It's got everything on it. Some plans may require that you use a network. I would say all plans require to use their network. You may need to, you're going to need a referral to see a specialist. So you're going to go to what is called the gatekeeper or a general practitioner. He'll be your contact doctor. And if you want to go see dermatology, guess what? You got to go with him. That's exactly how it works for me. I'm a Kaiser guy up here in Marin. And if I want to have a dermatologist look at my skin spots, I got to go through my regular doctor, send them an email, say, hey, can someone look at my skin spots? Then she, oh, absolutely. And she gets me the referral to the specialist. You may pay the Medicare, you must pay the Medicare Part B premium and the monthly plan premium. So you got two premiums you got to cough up every month, the Part B premium and the plan premium. You can only join or leave the plan during certain periods of the year. I just talked about that. And this Medicare Advantage plan doesn't work with Medigap policies. Okay, next slide. Okay. This is a new one, a new slide. It's just this year. Can I join a Medicare Advantage plan if I had end-stage renal disease? If you're already in a Medicare Advantage plan, when you develop end-stage renal disease or kidney failure, you can stay in the plan, or you may be able to join a Medicare plan offered by the same company. If you're in a Medicare Advantage plan that then leaves Medicare and no longer provides coverage in your area, you have a one-time right to join another Medicare Advantage plan. If you have an employer or union group health plan or other coverage through a company that offers one or more Medicare Advantage plans, you may be able to join one of that company's Medicare Advantage plans. If you're medically determined to no longer have ESRD, so this is the guy who got the kidney transplant and it's working, he's able to join a Medicare Advantage plan because he no longer has end-stage renal disease. It's one of the big success stories of Medicare since 1972, is that people can go on to ESRD, get Medicare, get a transplant, come off of Medicare. He's able to, or she's able to get a Medicare Advantage plan. You may be able to join a Medicare special needs plan that covers people with ESRD if there's one available in your area, and I forgot to check if there's one in Bakersfield. This is the key thing. Starting this year, people with ESRD may join a Medicare Advantage plan without restrictions listed on this slide, okay? This was a little history lesson. These people can use the 2020 open enrollment period, so they can use last October 15th to December 7th to enroll in a plan, and the beneficiary started in January 1st. So no longer is Medicare Advantage plans allowed to discriminate against people with kidney failure. This was something that was held on for a long time until Congress made us change it. It was because people with end-stage renal disease have a lot of medical costs and dialysis and things. And so now, just to be aware that all the Medicare Advantage plans, people can enroll, and because Medicare covers dialysis, the plans must cover dialysis with the local dialysis facility. Next slide, please. How are Medigap policies and Medicare Advantage plans different? Okay, Medigap policies are offered by private companies. I remember when I was young, there was a Mutual of Omaha's Wild Kingdom. And most of you are probably too young to remember Mutual of Omaha's Wild Kingdom, but they had this guy who was always wrestling with snakes in these mud pits. He said he couldn't keep him out of the mud pit, wrestling with a big giant snake. So that's a big company, Mutual of Omaha, and they have lots of Medigap policies. They sell a lot of Medigap policies to seniors. Another big company is AARP. AARP sells a lot branded Medigap policies to seniors. Medicare Advantage plans, on the other hand, are offered also by private companies. So it's a private company. What's the government oversight? For Medigap policies, the state provides the oversight. So the state of California provides the oversight for Medigap policies in California. So Medigap, so Mutual of Omaha, ARP got to dance according to what Sacramento says. But they also must follow federal laws because Medicare is involved. So they got to follow what Medicare says. The Medicare Advantage plans got to follow federal rules, and the plans got to be approved by Medicare. So we actually have a contract with them. So we have a lot to say about what they can and can't do. The Medigap policies, again, work in conjunction with original Medicare, and Medicare Advantage plans work alone with themselves, and there's no coordination of benefits with Medicare because your Medicare A and B are contained within the plan. Gaps, so what does the Medigap policy cover is gaps in the original Medicare coverage, like the deductible, co-insurance, and co-payments for Medicare covered services. If Medicare doesn't cover the service, then Medigap's not going to cover the service. Medicare Advantage plans cover all A and B. They must cover all A and B covered services and supplies, but they also can sweeten up the pot a little bit by covering things not covered by original Medicare, like, reading glasses, vision, dental coverage. Most Medicare Advantage plans include Medicare prescription drug coverage. And so I'd say, I remember Kern County, all of them included prescription drug coverage. You don't have the choice. You must have Medicare A and B to have a Medigap policy, just like in Medicare Advantage plans. You must have Medicare A and B. And as far as the premium goes, yes, in Medigap policies, you have to pay a premium for the policy, and you got to pay for the Medicare Part B premium. And then for Medicare Advantage plans, same deal. You got to pay a premium for the Medicare Advantage plan, and you also have to pay a Medicare Part B premium. Next slide, please. The other so I'm not going to spend any time on Medicare cost plans because these plans have pretty much gone away. Just every once in a while, you may so we have kind of changed. So there's these next couple slides talk about the other health plans that we have, and Medicare cost plans have pretty much all gone away. There were a different way that Medicare Advantage worked. They kind of predated the Medicare Advantage program. Okay, next slide. Okay, again, I forgot to check whether you guys have a PACE program, but so there's another health plans considered programs for all-inclusive care for the elderly, PACE. To qualify, you have to meet the following conditions. You have to be 55 or older. You got to live in the service area of the PACE organization. If you're certified by the state of California as needing nursing home level care, at the time you join, you'll be able to live safely in a community with the help of the PACE services. It covers both Medicare and Medi-Cal covers care and services. If you have Medi-Cal, you won't have to pay the monthly premium for the long-term care portion of the benefit. If you have Medicare but not Medi-Cal, you'll be charged a monthly premium to cover the long-term care portion of the benefit and a premium for the Medicare Part D drugs. And I'm sorry I didn't double check, but this will be homework for you guys to see if, hey, do we got a PACE program? Next slide, please. Okay, here we're already at quiz time. Medicare Advantage plans, and I'll let you guys read it on your own, and I guess I'll have to do this. Help pay for gaps in the original Medicare. Must keep the same providers all year. Are private plans approved by each state? Must cover A and B covered services. I got my choice in already.
Okay, we're hitting the 40-second mark. Again, I'll give you guys 1 minute to answer. 15 of the 24 that are currently here have answered the question. Okay, we've hit the 1 minute mark. Let me go ahead and end the poll and share results.
Man, you guys are good. I was almost bamboozled too to help pay for. I was going help pay. It pays. It's a wombo combo. It pays. It help pays for the gap. But actually, the best answer is it must cover A and B covered services, and that's a patient protection. That's in there. Is that you can't. If Medicare A and B covers it. And I guess as advocates, you should probably get the Medicare New Handbook, and just so you know what Medicare A and B covers. And if you are counseling people who are in Medicare Advantage plans, realize what Medicare A and B covers and make sure that that is also covered by the Medicare Advantage plan. Next slide, please. Okay, this is going to be you guys' favorite topic since you guys do a lot of Covered California anyway. So this slideshow is done by us CMS guys, and so it's got a national perspective. So I haven't really California-ized this, but it talks about, so whenever you see the word marketplace, being in Kern County, you gotta have to use your brain and kind of realize, oh, he's talking about Covered California. Okay, so next slide. Okay, Medicare and the marketplace, or Medicare and Covered California. It's against the law. We always make a big deal about this. It's against the law for someone who knows that you have Medicare to sell you a marketplace plan. Again, this is a patient protection thing that Congress wanted to have in there because we didn't want insurance agents to run around and scare seniors into being overinsured and pay for something they didn't need. If you're on Medicare, you don't need a marketplace plan because you got Medicare. Even if you only have Part A or Part B, they still shouldn't sell you any. The only exception are those small businesses. I talked about last week. There's things called the shop plan if you're an active worker. And so like small shops, small businesses, small print shops, less than 20 workers, they can ask you, hey, you're 65, take Medicare. That way we can get more out of our insurance payment. So you'll have people who work for small business, the size of your employer decides who pays first. So if you're a big employer, of course, Medicare will pay first. No late employment penalty if you enroll any time if you have shop coverage or within 8 months of losing that coverage. Shop plans are, again, they're for small employers. They're available through issuers, agents, brokers, and not through healthcare.gov. Healthcare.gov is where everybody goes, like your friends in Arizona, that's where they go. They don't go to Covered in California, you go to Covered California. Okay, next slide. You can keep a marketplace plan after you get Medicare coverage begins. But once your Medicare Part A coverage starts, you're no longer eligible for any premium tax credits or any other costs you may be getting from your marketplace plan. You'll have to pay full price for the marketplace plan. So, you sign up for Medicare during your initial enrollment period, or if you enroll later, you may have to pay a late enrollment penalty for as long as you have Medicare. There was a limited equitable relief, and this is granted by the local Social Security office manager, and that equitable relief was until June of last year for Part B late enrollment penalty. Next slide. So Medicare for people with disabilities and the marketplace. You may qualify for Medicare based on your disability, but you must be getting Social Security disability benefits for 24 months. On the 25th month, you're automatically enrolled in Medicare Part A and Part B. And remember, last week I talked about this little mailing you're going to get from Social Security. That's when you get the mailing from Social Security. If you're getting SSDI, you can get a marketplace plan to cover you during that 24-month waiting period. And you may qualify for premium tax credits, reducing your cross-sharing until your Medicare coverage kicks in. Then you want to stop your Covered California. You want to turn it off. Next slide, please. Choosing a marketplace coverage instead of Medicare. You can choose a marketplace coverage instead of Medicare if you are paying premium for Part A. So for people who haven't worked in this country for 10 years, remember those folks, or the folks that came to this country as older and have waited 5 years, and then they could get, could start getting benefits. if you're paying a premium for Part A, so those folks had to pay a premium for Part A because they didn't work in this country for 10 years. You can drop your Part A and Part B coverage and get a marketplace plan instead. If you only have Part B and have to pay a premium for Part A, you can drop your Part B and get a marketplace plan instead. If you're eligible for Medicare but haven't enrolled in it because you would have had to pay a premium for Part A, or you have a medical condition that qualifies you for Medicare like ESRD but haven't applied for Medicare coverage, and are you in your, like I discussed on the previous slide, are you in that 24 months disability waiting period? Next slide. Oh, I didn't realize we're going to go all the way. Oh, let's go to the question. So you're entitled to you're entitled to Social Security disability insurance, SSDI. You may qualify for Medicare. True or false? That's a tough one.
Okay, you have 1 minute to vote. We've reached the 20-second mark.
I'm going to talk. I remember I was going to mention on this slide. I'll do it after the answer.
We're at 45 seconds with 14 out of 25 people that have answered. Okay, we hit the 1 minute mark. I'm gonna go ahead and close the poll and share results.
Bingo. So the one thing I was going to mention about this group of the SSDI folks is that a lot of them, in my 23 years I've worked, a lot of them are not ready to accept that they're probably never going back to work again. Social Security is determined on the most part that they are disabled. The Social Security doc has checked they're disabled. They're probably not going back into the workforce again. A lot of people don't want to give up, they see that as giving up. And so I don't have a silver bullet. I just wanted to make you aware that, this group of people, I would say about a quarter of them, I end up getting into a little bit of a battle with. Like, oh, I'm going back to work. I just happen to have SSDI. Okay. So I'm kind of working with them and counseling them, but in their mind, they're going, they're done after this, after these treatments, after this, they're going back to work. That's fine. You got it figured out. But that's the struggle, is that that a lot of folks, the odds are, for the most part, otherwise Social Security doctor wouldn't have said, oh yeah, put them on SSDI because they're disabled under 65. And so it's I just wanted to give you guys that, because this is a group of people you'll be working with very closely, and just realize I'd say about a quarter of them are pretty difficult in accepting this new situation. You're entitled to Social Security disability insurance. You may qualify for Medicare. True or false?
We did the poll, Peter, and I think it was 19 people that said true.
Okay. Okay, next slide. Sorry. Okay, now this is right now you guys' bailiwick, help for people with limited income and resources. So let's see what we have to help people with. Extra help and duals. Next slide. So there's some help for people with limited income and resources. The first being Medicare savings programs. And what is a Medicare savings program? It's help from the state of California to help pay for your Medicare costs, including Medicare premiums, deductible, co-insurance, and co-payments. There's extra help for help and pain in Medicare Part B, Part D, prescription drug costs. Again, these are, so Medicare savings program, I would say, is administered by the county, your county-based system in California. Extra help is administered by Social Security and the county. Medicaid, or in this state, Medi-Cal, is a federal state health insurance program, been around since 1965. This is not new. In this state, it's called Medi-Cal, and it's, again, a county administered state, so it's administered by Kern County. The Children's Health Insurance Program, under-publicized program, unless you happen to be involved in youth programs in elementary, middle, and high school. It covers insured children up to 19 and may cover pregnant youth or pregnant women. Again, it's up to 19. If the family's income is too high for Medicaid. So I've done this Medicare talk with high school students, and I've been always amazed. About a quarter of my civics class are CHIP beneficiaries. Next slide, please. So here's some of the minimum eligibility requirements for the Medicare savings program. So I didn't want to knock you guys out, but I got to do it. So the qualified Medicare beneficiary, or QIMBY, is the individual monthly income limits is $1,084, and it helps pay for Medicare A and B premiums and other cost sharing like deductibles, co-insurance, and co-payments. The next program is the specified low-income Medicare beneficiary, or SLIMB, and that's individual monthly income limit of $1,296, and it covers the Part B premiums only. The qualifying individual, or the QI program, is the income limit is $1,456, and it again covers only Part B premiums. And then the qualified disabled and working individuals, their income is limited to $4,339, and it covers Part A premiums only. So also, I just kind of gave you I want to read this fine print. There's also resource limits for QIMBY, SLIMB, and QI. It's 7,860 for an individual, and for the QDWI is 4,000 for an individual, is the resource limit. Next slide. Okay, so now we jump into extra help, and again, we can go to Kern County for help, and we can also go to Social Security for extra help applications. The program is to help people with Medicare prescription drug costs, the people on Part D. It's also called the low-income subsidy. When you ask Peter questions, usually I say, "Oh, you mean the low-income subsidy?" You have if you have the lowest income and resources, you're going to pay no premium or deductible and only pay a small co-payments for your medications. If you have a slightly higher income and resources, you're going to pay deductible and a little more out-of-pocket costs. There's not going to be a coverage gap or late enrollment penalty if you qualify for extra help. And a special enrollment period allows you to change the Medicare drug plan once per quarter for the first 3 quarters of the year. If you want to change plans in the fourth quarter, you got to use the open enrollment period. Next slide. You automatically get extra help if you got full Medi-Cal coverage. If you get supplemental security income, SSI, or you get help from Medicare paying for your Medicare premiums through the Medicare Savings Program, sometimes called a partial dual. All others must apply. And so if you're not in these categories, you got to apply, and you go online at Medicare, at socialsecurity.gov, not Medicare.gov, Social Security, or you can call the Social Security line. The Social Security line is kind of nice for you guys living in Kern County, is that if you call it 4, you get the Hawaii call center. You usually get a pickup right away, and you can go through the application. You can ask for application for Medicare prescription drug costs. You can contact your Medi-Cal office there in Kern County. And you can also work with your local SHIP program. And I suspect you guys are also doing what do you call it, extra help applications. But you know, if you have any questions, you're welcome to talk to our folks at HICAP. Next slide, please. What is Medicaid? It's a joint federal and state program. It's called Medi-Cal in this country. It helps pay for the costs of people with limited income and resources. And some folks will be able to qualify for both Medi-Cal and Medi-Cal. They're called dually eligible. It may cover services that Medicare may not or partially cover, like nursing home care. That's the big one. That's the super big one, is nursing home care. Personal care at home and community-based services. Sorry, my numbers are so late, but it covered 71.2 million people in 2019. One of the gimmicks I use sometimes in my introductions is that I work for the CMS, and we run not only Medicare and Medicaid, but we also run the Affordable Care Act state exchanges. That makes us the largest health insurer in the world. So as you look at that 70.2 million people, that's a big number. And then you throw Medicare on top of it. It's a huge amount that the federal government puts into health insurance. Okay, next slide.
Peter, before moving on to the next slide, I have received some questions. So can we go ahead and answer those right now?
Sure.
Okay, cool.
We're 3:15, so I think we're striking distance.
The first question reads, a 64-year-old has Medi-Cal currently with a health plan. When he turns 65, does he cancel his Medi-Cal to enroll into A, B, D? Can he keep his Medi-Cal?
No. He would go ahead and just the county might even our records indicate that you're about to turn 65. Why don't you turn on that Medicare? The county is going to encourage that person to turn on Medicare. Why? Because Medicare is going to pay first. Medicare is going to pay the claim first. Then the state, the county can sit back. Kern County is the payer of last resort. That's one thing that's going on behind the scenes. And so it's in the state's interest, the state of California and Kern County's interest to get those people on Medicare in, because that way Medicare pays first. Then Kern County comes in and has to pay 20% that Medicare didn't cover. So it's the costs go down radically as soon as the person turns 65. So the whole system is kind of set up to get the person to sign up for Medicare at when they turn 65. And because they're duly eligible, they're going to provide all sorts of assistance as far as premium assistance and stuff like that. So Medicare can pay the claim first, and then the state can pay or the county, state and county can pay the claim second.
Great, thank you, Peter. So they are able to have both Medicare and Medi-Cal with
And that's
Medicare
what we
being
refer
primary.
to. Yeah, that's what we refer to as dually eligible, and that's a very popular in Kern County for those things. And the dually eligible folks, are usually, you're going to find, like I said before in the slide, in nursing homes. So people who have been, if they're already on Medi-Cal before the age of 65, it's going to be their benefit to have Medicare A and B turned on. And then it'll be in the state's benefit too, and the county's benefit.
Okay. The next question, and I am assuming it's in regards to Medicare enrollment. It states, where does the help come from? Is it in-person help? Do they call the client when they reach that point?
You mean the extra help?
I would.
So the extra help is the low income subsidy program, and
Okay.
you would be calling the Social Security Administration or the county saying, I'm applying for extra help for my prescription drug coverage, or you would be calling on the beneficiary's behalf. I'm calling on this beneficiary's behalf to get them signed up for the extra help. We wanted to use a word called extra help as opposed to low income subsidy. That's kind of like Congress talk, or legislator talk. Oh, the low income subsidy. That no person really uses that. So we use the word Social Security, and the counties use the word extra help. I need extra help with my prescription drug costs because my drug costs are so high, and that's how a beneficiary would think about it. And so the extra help is being provided in the form of financial, so they'll be paying less for their co-payments and drugs.
Yeah. The next question, what is the max penalty for not having Part D?
It's 1% per year. Oh, sorry, well, no, it's 1% per month. You could have had Part D but didn't, and so there's no max. It goes up 12% a year for every year you could have had it but didn't. And if you sign up, let's say a year late, it would be 12%, 24, 36. It goes up 12% per year. Sky's the limit on that one, and it is forever. However, the fine print is remember I had a slide that said if you were if you were an extra help person or a dually eligible person, the federal government never penalizes itself. So you would get it penalty free if you were needing extra help. Little known fact, but I mean it doesn't help. It doesn't help the people, the beneficiary any, but it does help you guys realize that the state and federal government does not penalize itself. We would like, okay, you get extra help, okay, there'd be no penalty.
Are there any additional questions anybody would like to ask at this moment, or perhaps type it in the chat? That was all the questions that I have received at this point. Okay, we have one more coming in. Are there 0 monthly premium Medicare Advantage plans?
In your part of the state, there are. and as I always get grief from seniors who go down south for Thanksgiving. I didn't look in Kern County, but I definitely know in Orange County in LA. Don't know if San Bernardino and Riverside fall into this category, but guys to the south of you, like I know Orange County and LA County, both have zero. They make a big deal about it. You sign up with us, you're not going to pay nothing. And in fact, they even sweeten the pot by we'll pay up to $60 of your Part B premiums. So come to us. And so that's very attractive. Because you're so close to LA, just be kind of looking every year if there are any 0 premium plans, or open up the Bakersfield, Californian. They will make a big deal about that. zero premium, and they can legally say that's free speech, zero premium if you sign up with us. Yeah, so there's a distinct possibility. I just didn't check. That's your homework, is to check to see if there's any zero premium plans in Kern County. I believe there are, because you're so close to LA that that you get that Southern California effect. Just so you know, on the Northern California, we're kind of sour grapes up here, because we have very few zero premium plans. In fact, our premiums are very high, $90, $60 a month for Medicare Advantage plans. And so people go down to LA for their Thanksgiving meal, talking to their brothers and sisters, and they're finding out, hold it, I'm paying $90 a month for Medicare Advantage in Sonoma County, and I could be here in Orange County paying nothing, for a Medicare Advantage plan. What? How's that work? And then I get a complaint. They complain to me, saying, how come Medicare doesn't make those guys in Southern California pay the same as us in Northern California? It's just the way actuarially it works out in the plan's business models. Maybe there's more providers. Maybe it's cheaper to live. Who knows? But it's it is what it is. So, good question. Probably more than you wanted to know, but good question.
I do not have any additional questions at this time, Peter.
Okay, let's go to the next slide. Again, this is very much in you guys' bailiwick as far as qualifying for Medi-Cal. The Medi-Cal program, so the Medicaid program, again, from the federal perspective, varies from state to state. So it's almost impossible to have a national Medicaid expert. It's really state by state Medi-Cal experts. So you have like the Medi-Cal expert for California, the Medicaid expert for Arizona, the Medicaid expert for Nevada. So just because it works this way in California doesn't mean it works that way in Arizona, Nevada, or Hawaii. In some states, you may need to be enrolled in Medicare if eligible to get your Medicaid. So remember, you guys were already asking me that last slide. Hold it. Do you have to be so not true in Medi-Cal, but I know that Medi-Cal in Kern County is going to really want that person to get on Medicare if they can. Call your call your county Medicaid office for more information to see if your beneficiary qualifies. And again, this is one of those moments of, when in doubt, fill it out. If you're having problems with your meeting medical costs, you think you're possibly at the level of getting Medicaid, get into that office and get an eligibility, start working with an eligibility worker and get enrolled in Medi-Cal. Again, the Medi-Cal program has been around since 1965. It's the same age as Medicare. So if you're helping people from out of state, because that'll sometimes happen with you, you'll have to like, oh, I got a guy from Vegas here. How do I deal with him? You can call Medicare.gov contacts on the web, or you can call 1-800-MEDICARE 24/7 and find out, hey, I got a Medicaid person here. They're from Vegas. How do I get them in touch with the state in Carson City to get them into their program? So that's the way I do it. Okay, next slide. How are Medicare and Medicaid different? This is important. Medicare is a national program that's consistent across the country, and Medicaid, or Medi-Cal, is a statewide program that varies greatly among states. I think one of the big things, like in California, Medi-Cal even covers people, beneficiaries who are undocumented. They can approach the program and not so across the border in Arizona or in Oregon. Medicare is administered by the federal government. That's who I work for, CMS. Medicaid is administered by California in conjunction with, well, in following the federal rules. So it's a federal-state partnership. And in California, just to complicate things, you always know how we do things different in California. Kern County and all the other counties for that matter, this state is a county administered state, so it's administered by the county. So the county administers Medi-Cal for the state. Medicare is health insurance for people 65 and older, and then folks under 65 with disabilities, or people any age with end-stage renal disease, kidney failure. Medicaid or Medi-Cal is health insurance based on need, financial or non-financial requirements. So it's in the old days, in the 60s, would say poverty level, poverty-based programs or anti-poverty programs. Now we would say it's a need-based program. It's based on the beneficiary's need. Medicare is the nation's primary inpatient hospital services to the disabled. Okay, so Medicare is the nation's primary payer of inpatient hospital services to the disabled, elderly, and people with kidney failure, ESRD. Medi-Cal or Medicaid is the nation's primary public payer of acute health care, mental health, and long-term care services. Next slide, please. Okay, so the Children's Health Insurance Program, and we've been spending most of our time talking about seniors, but also remember that CMS and also takes care of the Children's Health Insurance Program, which again in Kern County is county administered. So it's health coverage for uninsured children in families earning too much to qualify for Medi-Cal, but too little for covered California, or for private insurance, which was formerly private insurance before Obamacare. It's a jointly funded federal and state. It's jointly funded by federal and state governments. It's administered by the state, and of course, in your county, in Kern County, it would be county administered. 6.7 million children are enrolled nationwide, and for CHIP information by state, you know how I've been talking about Medicare.gov? We actually have a website, a whole website for Medicaid, and it's Medicaid.gov CHIP. So take that hot link, tap on that link, and you'll get to state by state for program information for CHIP in California. Next slide, please. Okay, these are the super helpful websites. In fact, I took a copy of this and I have it on my cubicle wall over there in the science station. Medicare is Medicare.gov. That's for all things beneficiary facing. So all the people who help beneficiaries like you and me and their families and the beneficiaries themselves, Medicare.gov. Medicaid.gov is your other portfolio, is for all things Medicaid. Again, both these programs have been around since 1965, but Medicaid.gov has its own program. It has its own website, Medicaid.gov. Social Security has its own website, that's socialsecurity.gov. The Health Insurance Marketplace has a website at healthcare.gov. The Children's Health Insurance Program has has its own website, and it's not chip.gov, which I would think it would be. It's insurekidsnow.gov. The National Training Program, where all these slides came from, and where you guys found me, is CMS National Training Program.cms.gov. I encourage you to become familiar with that portion. If you notice, it is on cms.gov. So because you guys are in a health system, very often you'll get questions from your bosses to pull data and different things. For research projects, for researchers, academe, healthcare systems like yours, doctors, billing departments, hospital administrators. We have a website called cms.gov. And that's where this national training program stuff is incurred. So you're not going to find it on medicare.gov. You'll have to go to cms.gov for that type of situation. So we have all sorts of training materials there for partners like you. We have the state health insurance program, which in Kern County is called HICAP, and it's the SHIP TA Center, and that's, you're welcome to go there and poach their beneficiary facing materials. Next slide. Key points to remember. Medicare is a health insurance program. Medicare doesn't cover all the health costs that one might run into. You have choices on how to get your coverage. There are programs for people with limited income and resources. And your decisions, or the beneficiary's decisions, affect what type of coverage they get. And certain decisions are time sensitive. Next slide. I'm not going to go through this slide, but I want you to be very available for the acronyms. This is what hopefully during my talk, I didn't use a lot of terms like VA, I didn't use VA, or SSDI. This is a cheat sheet for all Medicare speak. HSA, health savings account. So I definitely give this to all the new CMS employees or the new Medi-Cal employees when they come on board. I say, here, you want to have this list of slides, because a lot of times in government we speak in abbreviations, so it's there for your use and misuse, so you'll know what's the eligibility worker talking about. I was in a call today and someone was talking magi. You know, I'm talking about, three wise men. You say magi to me, but in Medi-Cal, magi means something different. So it's good to have a cheat sheet. So I want you guys to stay connected to me. I think we're going to be joined at the hip here on out anyway, but the CMS National Training Program is available for people like you who help people learn about Medicare things. And contact us at training@cms.hhs.gov, and you've got me. And coming up this year, we're going to have every year we have a national training program from mid-July into early September, where we have different topics twice a week for an hour and a half, kind of like what we did today, on different Medicare topics. And I would definitely keep an eye on that and take those classes that you're most interested in. They're available. You'll be in these classes have about an audience about 900 people. And the format's exactly like the format we had here today, where you can type in your questions and get chat and with the national expert. So I encourage you to do that. Okay, next slide. Additional resources.
Yes, so this is, I believe we're at the end of the presentation. This is
okay.
Yeah. I would like to stop here and see if there's any questions for Peter. I do have one, and it states, can someone have all parts A, B, C, and D at once?
Yes. In fact, let's say the person wants to be in Kaiser Senior Advantage down in Kern County. They would have Medicare A and B. They would sign that over. That would be signed over to Kaiser, and they would receive their C and D. They would receive their A, B, C, and D from Kaiser Senior Advantage in Kern County. So that, I would say, a great many people you deal with in Kern County, because you have a lot of Medicare Advantage plans there, are going to have A, B, C, and D. So like, let's say, let me pick on a guy who wouldn't have that. Let's say, remember that veteran I was talking about who goes all the way to the VA, he uses the VA clinic in Bakersfield. But then if he needs any hospitalization, he goes over to Westwood, you know, on off the 405 there in LA, and he just drives over there. He would have Medicare. He just kind of decided, I'm going to have Medicare A because I worked and I paid enough Social Security in. I don't need no B. I'm just going to go to the VA. I don't need no C. And I don't need a D because I got my prescription drug coverage through VA, and it's credible coverage. So if at a time I want to turn it on, I can, penalty free. So he may have only just A and B. He wouldn't have B, he wouldn't have C, he wouldn't have D. He would just have A and the VA. And he also realizes that VA and Medicare doesn't really coordinate. So that's one group of people who might not. It would be wise for him to have Medicare A and B, and maybe not D, but Medicare B might be wise for him just in case something bad happened. But you know, it's a free country; he has the right to choose. Another group I will pick on is, like, let's say a person who has been in uniformed service in this country for 20 years, then is then now retired military service. He would have Medicare A, and then at age 65, he would get a letter from TRICARE for life, and he would have to, and the letter would say, if you want to retain your Medicare, your TRICARE for life benefits, turn on B now. So he would turn on Medicare A, he would turn on Medicare B, he wouldn't need D, he wouldn't need C. So he would just be Medicare A, B, and TRICARE for life. You know, the third group I would think about is school teachers. Some school districts in Southern California, I don't know about Kern County, but some of the districts in Southern California never paid into Social Security. You get your pension through the school district. They have their own retirement system they pay into. They have their own. They don't even pay into Medicare. They have their own system. So the person wouldn't turn on A, wouldn't turn on B, wouldn't turn on C, wouldn't turn on D. They would just get their pension from the school district, and they get their health and welfare benefits from the school district. A lot of school districts are saying, oops, we shouldn't have done that, because it's better if at age 65 the person had Medicare, but that'll happen. And then my last example will be state, city, federal, not federal workers, but state, firefighters, policemen, city workers, state workers. A lot of them are in CalPERS system you've heard about. So CalPERS at the age of 65 sends a very firm note to its retirees saying, I hope you're enjoying your retirement, but it's now, our records indicate you're now 65, so turn on Medicare if you want to retain your health and welfare benefits in retirement. So that guy would be, that retiree, the city, let's say it's a city retiree, would have Medicare A. They got to turn on Medicare B because CalPERS said, and then they would have their CalPERS, their health and welfare benefits in retirement, their health care and retirement. So Medicare would pay the claim first, CalPERS would pay the claim second. They wouldn't need D because they have credible coverage. They wouldn't want C because they already get their health insurance through their former employer. Otherwise, yeah, your question was completely correct. A great many people you run into will have Medicare A, B, C, and D. They'll have everything together, and it'll probably be in a Medicare Advantage plan of some type in Kern County. Sorry, that was a long answer for a short question.
No worries. Also, does Medicare cover dental care, hearing aids, and eyeglasses? And what part covers those services?
So incrementally, things have been changing from the Medicare world since 1965. So the big thing we were talking about today was prescription drug coverage. For a long time, prescription drugs weren't covered by Medicare, but then it took an act of Congress, and the Bush 2 administration signed it into law. And so since that time, seniors have been able to enjoy Medicare drug coverage. So the only way to get to glasses, hearing aids, dental, is to see if the Medicare Part C plan or the Medicare Advantage plan offers that as a tantalizing membership getting gimmick or benefit. I just happen to be, from the consumer side of things, Medicare does not include glasses. The only way Medicare would pay for glasses would be if you had an eye operation and your vision changed, then they would have to issue you a new pair. Only medically necessary glasses would be issued. And if you want designer rims, like most of us want, forget it. You're going to have to pay extra for that. So Medicare generally doesn't cover it under glasses under very, very, very limited things. Hearing aids are outside of the outside of Medicare coverage also. So hearing aids are not covered. And then the last is dentists. So dentists have not only gotten out of Medicare, there's very, very few dental procedures which are covered by Medicare. Sometimes medically, you need to get your teeth removed if you're having a heart procedure. So if there's a medical necessity for the dental procedure, and it's teeth extraction, or because of a surgery that you have to take. So sometimes as cardiologist, the heart surgeon won't go in there and do the heart surgery because, hold it, your teeth are rotten, they need to come out. I don't want to have an infection from the tooth going down into the heart. So that the manual extraction of the tooth, and then sometimes if something bad happened, and there needed to be, so the surgeon had to do something with the jaw or mouth surgery. There was some procedure that involved the mouth, and then but they needed to have the dentist come in and handle, again, tooth extraction in order to do that, do the mouth operation. Then that is allowed. That being said, not many dentists are involved in Medicare. So it's kind of hard to hook up. It's very, very hard to hook up. The person who needs to have this manual extraction done because of medical necessity, to get a doctor who's local to do that, or get an oral surgeon to do that, because very, very few dentists operate with, are in the Medicare program. The other group, which is hard to get hold of, are plastic surgeons, because Medicare doesn't cover a lot of plastic surgery procedures. So, they're not, it's hard to find for those procedures which are covered by Medicare, it's hard to find plastic surgeons who take Medicare too. But so the only way to get, to answer your question, the only way to get those services is to see if a Medicare Advantage plan offers them. But generally, vision, dental, hearing aids are not covered by Medicare.
Okay, thank you. And then is there training on how to fill out an application for Medicare?
There is no training to fill out the application, but it should be pretty so it should be, beneficiaries should be able to do it on, on the web, or even on their phone, by going to the Social Security website. I'm trying to flash my phone again, but the camera's not picking it up. So it should be pretty self-explanatory for the beneficiary and for the family helping the beneficiary sign up for sign up for Medicare.
Okay. Are there any additional questions before we continue with the presentation for Peter? Okay, can someone consider switching Medicare supplement insurance plans?
Yeah, so because you live in California, so this is the supplemental plan or Medigap plan. There's something called the birthday rule in California. So every year you can assess where you are for your, in your Medicare plan, or so your Medigap plan or your Medicare supplemental plan, and you can always go down market. So let's say you have a rich plan, and you want to, like, let's say, pay less premium. You can always go down to a lesser plan. So it's probably to the beneficiary's advantage to, at the age of 65, when they have Medigap guarantee issue, to pick the because they don't know what their medical situation is going to be like. Maybe buy an expensive plan. It goes a couple of years, they realize they're paying too much premium. They're not really not that ill. Maybe it's, they feel like they can take a little bit more exposure. Every year they have something called the birthday rule in this state, and they can switch to a lesser Medigap plan. Otherwise, the big time period for Medicare supplemental insurance is the time, that guarantee issue period when you turn 65. If you decide you want to be a Medicare A and B person, and you don't want to have a Medicare Part C plan, you don't want Medicare Advantage, then you should use that guarantee issue to find a plan that covers your costs and get them, because that way it's going to be, during that guarantee issue time, it's going to be the cheapest and most beneficial to the beneficiary to get a plan during guarantee issue. And then you can make downward adjustments if you've got a plan that was simply too rich. I've never had anyone complain to me once they get to age 75, oh, I bought a plan that was too rich. Nobody ever complains about that. But in California, you do have the option of stepping down if maybe you got too big of a bite and you want to get a lesser or equal plan. And it's called the birthday rule. If you have any problems with this, call our friends down at the Kern County High Cap. They know all about how to do this.
Thank you, Peter. Very helpful information. I know we had all these questions and you answered them so eloquently. Give us a lot of good information to take back to the, as we work with seniors and trying to guide them through the Medicare health plans and their options. So thank you very much for being our presenter last week and this week, and we really appreciate you making the time to come and do this for us. So I don't think we have any more questions. We're gonna go over to the additional resources, and Marisol is gonna lead us through that. Thank you again, Peter.
Well, thank you.
Marisol, I think you're on mute.
Got it. Okay, so I'm just gonna briefly review the flyers that you have as part of your packet. The first flyer that you see there is our About Us flyer. This is just more information about our program, the services that we offer, our vision, and also a little bit more information about our partners. As you know, most of you are part of our CEC network meeting. I believe I also see some of you that attend the org meeting. And we have this collaboration so that it allows us to share information and best practices among our agencies, and also working together to remove barriers and create one voice message for maximum community impact. The next flyer that you see is our standard outreach flyer. It's just basic information about what the items that we do. We help with Medi-Cal, Cover California, Medicare. Our services are always free. And we have certified enrollment counselors ready to help. Right now, at this moment, due to COVID, we're not doing any in-person appointments, so everything is done over the phone. So we have that message right there. The next one is our client referral form. So if you ever have a client that needs our assistance, you can complete this form, fax it over to us, and then we'll contact the client. After that, we're going to try to contact the client 3 times. If we are not able to reach out to the client, we'll give you a feedback in regards to the tracking. As we'll do the same if we're able to reach to the client. That way you're informed about what's the outcome for that client. The next flyer that you have is Are Confused About Medicare. It's just a little bit more information. Who is eligible for Medicare? When can they sign up? The different parts of Medicare, and as well a little bit of what is Medi and why you should be interested about that. We have them both English and Spanish, so you'll see those. And then the rest of the flyers is our set of Yes Medicaid cover set flyers. It includes information about all the benefits covered under Medi-Cal, dental services, vision services, mental health, and physical health. As you can see, the dental, vision, and mental health, the backside, it has information about the providers that are accepting Medi-Cal here in our county. Obviously for the physical, it's a long list of doctors and health providers that accept Medi-Cal. So we don't have information for that, but we do have information about the health plans that are part here of our county, and you can just reach out to them by the phone number or their website, and you're able to find providers there. And that's it for the flyers that we have. And just like I mentioned before, if you want any copies of this, you can reach out to me or Argelia or anyone else on our team, and we can deliver some copies to you.
Thank you, Marisol. Same as last time, we would like to open up a poll to end our session, and this would just be an evaluation in regards to the Part 2 training. I'm launching it currently at this moment. Marisol will also share a link in the chat, which will take you to another page where you will be able to actually type in any suggestions or comments and any other topics of interest that you might want to see at our future trainings or meetings. I know that the Zoom poll is kind of limited in that aspect and doesn't allow you to share any comments or feedback, but the link will allow you to do so. Both of these are anonymous entries, so we won't be able to see who has submitted it. We'll just be able to see the responses. So we appreciate your feedback. It always helps us a lot in our planning for our next training and network meeting. So please take some time. It's only 3 questions, I believe, under the link, and then for the poll as well. It's only 4 questions. And I'm not sure, Peter, if you want to share any last words.
Yeah, I was just amazed at Marisol's flyers that she had. That has all the providers there, which is priceless. Always a big challenge for folks is trying to find access to care, to find a dentist. And so I was reflecting back on the dentist question, and again, Medi-Cal covers dental, and it does cover things that Medicare doesn't cover. So if you think about like the folks who might be disabled under 65 who might need a mobile wheelchair for mobility outside the home, for cruising around, doing groceries and stuff, Medicare doesn't cover that, but Medi-Cal can and often does. And so very often you'll see a situation like what Marisol showed us, that Medi-Cal has benefits beyond what Medicare will have. And so it's very good that you have, like I noticed you have a great network of dentists in Kern County that people could go to for dental procedures. But the deal is you got to be on Medi-Cal to get it, so, but it is a very good tool. So anyway, I was very very impressed to see the list of providers.
Thank you, Peter. I know Marcel, with the help of our community health workers, always tries to keep the provider list updated, and so that they can provide that to their clients. And when they reach out to find a provider or call, that list is up to date.
All right. Well, thank you everyone for participating in today's training. We hope that you got a lot of good information. And please fill out our poll and our questionnaire so we can have good feedback for helping us with planning our next training. All right. Thank you, everyone.